The nurse is caring for several clients on the respiratory unit who are receiving beta adrenergic agonist, bronchodilator, albuterol in the prescribed nebulizer treatments. Which side effects, important keyword, which side effect will the nurse expect to assess following administration? Select all that apply. So remember what I taught about side effects versus adverse effect. So a side effect is an undesired expected effect of a medication that can be treated and usually is not going to cause a life-threatening condition. So let's review answer number 1. And I see several of you selected answer number 1. Increase tachypnea. So increase the rate of breathing. If we're giving a bronchodilator, albuterol, you have to think of first, before we think of the side effect, what is the intended effect? Why am I giving albuterol? In many cases, could be to treat wheezing, difficulty breathing. It's given in many conditions. It's given in COPD, chronic obstructive pulmonary disease. So, what is the expected therapeutic effect of a bronchodilator? If a patient is having difficulty breathing and we give a bronchodilator, a medication that is going to dilate the bronchioles, the patient is going to be able to breathe better. So we are not expecting a higher respiratory rate or tachypnea. We are expecting a decrease in the rate of breathing. So answer number 1 does not make sense to the intended effect of the medication. Now, irritability and nervousness, shakiness, we see that as a side effect of albuterol, of a bronchodilator. So answer number 2 is a definite correct answer. Now, what do we see in patients that take albuterol, a bronchodilator? We see that the heart rate goes up. So we see tachycardia. This is why in patients that are already tachycardic, we have to be careful when we're giving this medication. So tachycardia is a side effect of this medication. Increase somnolence. And I want you to compare answer 4 and 5. Because they are opposite to each other. And this is a strategy that I use in Select Other Applies. I try to find if there are answers that are similar or opposite to each other. So, what can this medication cause? Somnolence or insomnia? And look at the other answers. Irritability, nervousness. You think the patient is going to be with somnolence or insomnia? If you see irritability, nervousness, and tachycardia. And answer number 6, anxiety. So if you think about this, irritability and nervousness, tachycardia, insomnia, and anxiety, they're kind of related to each other. Think about it. And it is opposite to answer number 4, somnolence, which is the opposite of a patient that is wide awake or very awake. Therefore, answer number 2, 3, 5, and 6 are the correct answers. We eliminate answer number 1 and answer number 4. And this is the scenario that I was giving you. Let's say in your answers you selected 2, 3, and 5. And you forgot answer number 6 is wrong. Let's say that you selected 2, 3, 5, 6, and 1. Wrong answer, because you selected an incorrect answer. So it is an all or nothing scenario. Starting April 2023, it's going to change. The NCLEX will be different, and the way they're going to calculate if a question is right or wrong is different than the way they do it now. But we cannot worry about 2023 yet, because we're in 2022.